Well, hello, everybody. I want to welcome everyone to our Members on Monday here on, I guess it would be our Facebook channel at the Orange County Chamber of Commerce, and want to welcome everybody and hope that everybody is well. And I want to particularly thank Dr. Albie Silver and our good friend and board member, Linda Muller, who's the CEO and president of Cornerstone, for being here with us today. Before we start, there's a few housekeeping things I want to let everybody know. Is that tomorrow we have Facebook Live, our regular breakfast. That will be with County Executive Steve Newhouse, and that will be here on the Orange County Facebook page. And that will start at 10 o'clock and going towards to 11:30. If you go on our Facebook page, you will see all the other events that we have, which are a lot. So you're all welcome to come and join us. There's a lot going on. Next week, we'll be talking with Janet Giannetta about being able to keep employees. There's a lot happening in the world. There's a lot happening in Orange County. There's a lot happening regarding reopening. So I do want to let everybody know that we are helping many of the businesses to come up with their reopening plans. So you can always contact us, and we'll be happy to go with you the CDC guidelines, the guidelines that the governor has laid out, what the Department of Health has put down, because we're here to help you. Some of the other things that we have going on are we have an Orange County restaurant takeout page that is loaded with members and non-members, all the restaurants in Orange County with all of their takeout. And we also have an e-commerce page, which we're helping the retailers in Orange County by providing you as their customers the opportunity to see what they sell. Retail, as you know, will not be open until phase 2. There will be limited retail for curbside for phase 1, but we're not there yet. We're not even at phase 1. So please feel free to just, to contact us. We're here to help you with the PPP, the SBA loans, any of the other private loans, MWBE will be happy to help you. Unemployment, help walk you through the process, and if necessary, to help advocate so you're able to access those programs. So now, without further ado, I am going to start with discussing with Linda Muller and Dr. Albie Silver some of the things that's happening. We are in, as say, unprecedented. Absolutely unprecedented times now. And Cornerstone, you folks are really at the forefront as primary care providers here in Orange County. And I want to thank you for everything that you're doing, because you really are in the middle of the fire. You folks are at the front line of everything that we're seeing. So can you just tell us, and thank you, obviously, thank you for everything that you're doing. Thank you for keeping everybody safe. So can you speak a little bit about what's happening at Cornerstone now, and then we'll start.
Sure, I'm happy to give you that update. So March 10th is when patient zero entered into our health system and changed the way we did business since then. In the beginning, we really didn't know much about COVID-19, wasn't really sure about how the transmission happened. And as time evolved and we learned more about the infection, we learned how devastating the illness can be should you contract the disease. We really had to transition our business from being one where we were doing face-to-face encounters with a patient to telemedicine. Back before March, we were averaging about less than 400 visits a month. Now we're over 2,200 visits a month in telemedicine. Well, you think about it, how much have we seen on the television? Stay home, be safe, not just for you, but for everyone else. Shelter in place, don't go out. You're safer at home. And people really heeded that information. But what it does do is it impacts the relationship between a physician and their patients, because patients are afraid to go out, and you really don't want to go to the place where the infection is, right? And that's at the doctor's office or at the hospital. So I know that Dr. Silver and his colleagues are concerned that patients who should be coming in are not. And I'd like to just ask Avi if he wouldn't mind kind of talking about, from your clinical perspective, where the health center is with working with our patients.
Yeah, so telemedicine is definitely, we spent a couple of years trying to get it going, and then when when COVID started, we got it going in 2008. So the need of drugs. I think if you look at the number one and number two comorbidities, things that really.
Javi, your mic is not as loud as it should be. Maybe if you got closer. There you go.
Yeah, forgive my close space. Can you hear me now?
Yep.
All right. So when you look at the number one and number two comorbidities that go along with COVID or bad outcomes, is poorly controlled diabetes and poorly controlled blood pressure. Those are things. So everyone's worried about getting COVID or not getting COVID. We need to control those other chronic diseases and make sure that this has been going on for a couple months now, that we don't neglect our regular routine care, because that's what's going to protect us mostly from, from the COVID. So, we have all our docs capable for doing telemedicine, getting on the phone with them, getting on the Skype with them, and making sure we're managing their chronic diseases. So we are calling patients, we're reminding them, we're watching our patients that have chronic diseases. At the same time, we've really stepped up and we're managing all the people that are coming down ill with it. If people are calling and they're sick, we're doing telehealth appointments. And if they need testing, we're doing testing outside our health centers in a safe location. And now we also start some antibody testing to see, who's been exposed. From the beginning, we've also made sure in it, listening to like the AAP, we made sure we want our pediatric patients to come in as well. Vaccines are just so important. We don't want to have one crisis of COVID coming in and causing a measles outbreak or some kind of other outbreak that we're going to have when vaccination rates go down. In addition, there are things that we pick up in a physical exam. Sometimes there are only teachers and doctors that pick up things in child's development, and it's not being picked up at home. And now that the kids aren't going to school, they're not being seen by their elementary school teachers, and being seen by the pediatrician is really just so important to monitor their growth and development. So we're seeing everybody by telemedicine if they need first, and then sometimes they need to come in and be seen at the health center. I can't give a vaccine through the camera, but we are. Can you hear me, by the way?
Absolutely.
Okay. We're keeping everything safe. When you walk into our building, we're screening everybody with temperatures and questions, making sure there's no exposures. If there's any symptoms, we have an area where we're monitoring sick, people that might have symptoms, and really separating out people that are just well and need the chronic care. So we're doing that because it's really, as this is a marathon. This is something that we're going to be learning to live with for a while. So we have to make sure we're not neglecting our everyday care.
Yeah, I have a question for you, Dr. Silver. When you mentioned diabetes and hypertension, do they know what the link is with COVID? Why that's become such a predisposing factor for it?
Yeah, we always have to say this is a rapidly evolving situation.
Right.
So we can't make any, we can't really say exactly what's going on.
Understood.
We definitely know when I look at the comorbidities that are listed, it's diabetes and hypertension. We also know there's a lot of problems with clotting and the blood vessels. And if it's a vascular disease, controlling your diabetes and controlling your blood pressure is the best way to, prevent that. So that's my guess, that it's a small vessel disease, and those are diseases that affect your small blood vessels, that affect people's risk of stroke and heart attacks and things like that.
Okay. I do want to just reinforce something that you said, because you had mentioned about how clean everything was. And I do want to commend you, because when I had brought some dessert over for your people from the chamber, it was immaculate. And I really have to say that the precautions that were put in place, that I was not allowed to come in unless I had my temperature checked. And the people at the front gate were absolutely fabulous in making sure that all protocols were being followed. Everybody was masked. Everybody was gloved. So if I had to go in there as a patient, I would feel very secure. So thank you for.
And it takes a little more effort to get through the door, and I think everybody really appreciates that, because we're doing everything to keep our patients safe. And we have sections, that we'll see you if you have an acute problem, but just really want to, separate that out.
So then, so that's what you're seeing now. So telehealth has now become, Linda, you said this telehealth now is a big factor with you. What are some of the other things that you're seeing as far as Middletown and Newburgh and some of your other delivery areas, and how is that affecting the health center? How is that affecting you folks? Because I
So
know it's affecting as a business. I know it's affecting the businesses tremendously.
uh, let's begin by just saying that our business today doesn't look like our business February. The total number of patients that we've seen is not unlike any of the other primary care practices in our community. They've dropped off. Clearly, they've dropped off, which is affecting us from a financial standpoint. We've done as much mitigation as we can do, controlling our costs to ensure that we can meet our revenue standards. We've done some things that ordinarily we wouldn't have thought of doing. Unfortunately, we had to furlough some staff to cut our costs of those. I hate using those words, non-essential personnel, but we had to keep nurses and doctors and LPNs and emergency dentistry open and podiatry opened and substance use disorders open and behavioral health open. So some of the programs that were used to support those patients non-clinically were the folks that we had to unfortunately, put on hold for a much longer period of time than I would have liked. But the business has to continue. And the reason why it has to continue, I think that your listeners, it's important for them to understand that Dr. Silber is not a partner. He's not an owner. I'm not a partner or an owner. I'm an employee, just like he is. And we choose to be here because we believe in our mission. And our mission revolves around ensuring that everyone, regardless of their circumstances, has access to the best quality care. If people have been watching the news and watching the horrific numbers, watching the pictures of what happens, we know that the communities of color, the communities where there is high density of poverty, are the ones that have been hit the hardest. Why have they been hit the hardest? Well, people who are undocumented, immigrants that are afraid to come out of the shadows because they don't want to get deported. So the connection is, if I go to the doctor and if I'm positive for COVID-19, some authority is going to know about it, and that jeopardizes my ability to stay in this country. So they've stayed out. People that don't have the money and don't know they could come to our health center don't seek care. So what we've been able to do in managing our almost 50,000 patients, which I don't know where all of you are, but come on back to the health center. It's okay, because you're certainly not coming in. The same issue that we've always thought about, and what Dr. Silber, why he's been with us for all these years, is that we still we're leveling the playing field for everyone to get access to the very best care that's possible. And my clinical team under his leadership have done a remarkable job. We've tested just short of 2,000 people for COVID-19 over the course of the last 6 weeks. 850 plus have been positive for the virus. Out of that, less than 30 have been hospitalized.
Oh, wow. That's a great ratio. That's very good.
Remarkable. And I say the same things that I always like to say, is that the reason why those numbers are so good is because we've been able to manage their diabetes. We've been able to manage their other comorbidities of hypertension, COPD, the whole gamma of initials I can give you, that the folks have been engaged in real good quality care. And so that has reduced the need for hospitalization. Our financial situation is one that is not only our health center, it's over 1,400 health centers across the country that care for more than 30 million people. I just want to say 30 million people.
That's a lot of people.
That's a lot of people. Should there be a reason that we weren't here, just for a moment, our health system is not equipped for us not to be here. We're the buffer between the community and the hospital. We're that stop in between. So if we have a patient who's really ill, of course, we have a relationship with all of our hospitals to transfer to the appropriate place of care. But most patients don't need to go there. Most patients get managed at home, whether I know I can say this because he went public. Our senator, James Skoufis, is a patient of our health center, and we managed his COVID-19 at home. We've replicated that over 800 times. Our success rate has been great. Not that anybody wants to go through this, but would those 800 people would have shown up in the emergency department or in the hospital if they thought that, if we didn't think that their system was overtaxed today, what would it have been like had we not been here? So, it's really important for folks to understand what our job is. These are board certified positions. Dr. Silber is a board certified pediatrician. He can choose to practice wherever he would like. He chooses to practice with us because the man has got a mission to ensure that all of the kids that come to our health center are safe, and can do one thing and one thing only: grow up to be healthy, productive adults. And that's what he and his team do every single day, even in this new world of COVID-19.
But that just gets back to your whole mission, because ever since I've met you, you have always, your mantra has been healthcare is a right, not a privilege, which it's starting to get some steam now. But I'm sure when you first said it, it was going against the grain for a lot. But I do know, yeah, and it's
the kicker that is as everybody starts talking about Medicaid for all. People just need to understand that we're the provider of all. We practice this every day of our lives. So why do you need to reinvent a whole system? Why not allow for community health centers across the country to continue to do the job that we've always done? And we've been doing it since 1967, having our ability to manage every patient, regardless of their ability to pay or any of their other issues within their lives, whether documented, undocumented, gay, straight, black, white, pink, purple, whatever you religiously believe. It doesn't make a difference. We provide the same level of care in our communities, healthcare delivered locally. We're an economic engine in our communities with great paying jobs that keep the communities going. So just why not understand that it already exists? Healthcare as a universal opening exists in every community health center.
And it's not to draw it as an analogy, but you're speaking about how you are the great equalizer in healthcare, regardless of somebody's ability to pay, whether they're pink with purple stripes, it doesn't matter. They're a human being, it doesn't matter. And you know what? That's the way the virus operates. Doesn't matter. Doesn't matter how rich you are. Doesn't matter how, what color you are, if you worship God, if you worship a rock, it doesn't matter. Male, anything. And so we're looking at this and seeing on the news all the time and listening to Governor Cuomo and then Steve Newhouse's updates about how it's affecting and how the communities of color, and looking at the graph and seeing around Orange County, those areas that are so highly affected, especially in nursing homes. And I know that, you treat, seniors and everybody. So it's very reassuring to know that within our community that there are doctors, and thank you, Dr. Silber, who it doesn't matter who you are. It just matters that you're a human being, and that's the baseline. Are you a human? So you did mention, just to make a little bit of a segue, because I know this is something that we've questioned, and there's a couple of members who I kind of steered to watch this, because this is, I believe, where their questions were: the antibody testing and the regular testing. So there's all this discussion of how important the testing is, the regular testing for COVID, and how that's going to monitor, how that's part of that that valve that the governor talks about is the testing, and then also the antibody testing. Could you both speak a little bit about that and why that's important and exactly what that means as far as infection rate and how we can track that?
Okay. So we're doing the two types of testing, like you said, that's available to us right now. There's the nasal swab, the one that has to go up the nose and almost feels like it's to the back of the brain over there, and that's the one that you're doing when you're sick, when you're ill. That should be positive in that first 14 to 21, sometimes week days. And those are the ones that's really useful, because if you think you have COVID, if you might have the symptoms of COVID, and we're able to make that diagnosis, we know we have to keep you at least 10 days out and in isolation. We know that the people that you've been exposed to need to be tested and monitored and kept out of isolation. And that's how we're going to actually monitor, monitor and maintain and stop the spread of the virus. So it's real important to keep that testing going, and we're still doing that. The antibody testing is a little bit newer. What that shows you is whether you've been exposed to the virus or not. The test we're using, an IgG test, takes about 14, but really about 21 days for those antibodies to show up. The antibodies are the body's reaction to the infection. So it's going to show that you have some ability to fight the infection. That's how viruses generally work. That's how vaccines work. You see a disease, you develop antibodies, and hopefully that gives you protection. This is a novel coronavirus, so we're still waiting to see, until they're able to take those antibodies and culture, put it culture a virus and see that it stops the spread of that. We can't say whether or not that's going to give you absolute protection. So right now, the antibodies are just telling us that you had an exposure, that you had these antibodies. They might give you some protection like other viruses do, but we need to wait and gather more information to see exactly what that means. But the more information we gather, the more we're going to be able to make decisions, and information is power. And we're going to be able to see, how much, what's the rate of asymptomatic people in there and how much we have to worry about that. We're going to see, we're doing antibody testing now, and I think we're seeing more people that thought they had a virus. I had maybe a flu-like illness, like 6 weeks ago. I want the antibody test. I want to know if I've been exposed. And they're finding out, no, they weren't exposed. So rather than people were worrying and saying, are people going to get the antibody test and run out there and not be careful? I think it's actually serving us on the contrary, where they're saying, ooh, I am still having seen the virus. I need to continue to be real careful. I need to socially distance. I need to listen, to the recommendations out there. But it's not a free pass yet. But it is something that's I think will be more useful information as we go forward and gather more information.
Is there an antibody test that's better than the other? Because there's a finger prick, there's a blood draw. Is there a specific test that somebody should be looking to take?
There are a lot of tests out there. In the rush to get all that information, the FDA has put out something called emergency use authorization, and they've allowed people to put out a lot of tests. They're all different a little bit. I think a lot of them are good tests. Some are not as good. So you want to do it with a highly complex lab. Like we're doing with BioReference. They're a highly complex lab. I would be a little bit more skeptical at this point if, to a doc's office, I bought a box of tests that you do on a finger prick. I want to make sure you're doing it from a well-respected lab that has, a good company that you could, trust, that, someone that has a track record. The next phase they're going to look at, there's one test in the country so far that's an antigen test. It's a little different. It's a rapid test that is not available to most people yet, where they'll be able to do a nasal swab and tell you if you're infected fairly rapidly. And I think that, months from now, that might be the way we're going to be managing this disease, where we're going to be able to tell you really quickly whether you have an infection right now. Like right now, you could come into my office in the flu season, and in 10, 15 minutes, I'm going to tell you whether you have flu or not. I'll back it up with that lab test to know for sure, but I'll be able to get good information. But I would do an antibody test through a legitimate medical provider that's sending it off to a legitimate, highly complex lab. And then there's a lot of tests out there that are being approved right now.
Okay.
To put it in context, there are over 165 different tests that are available. So the public is confused about what tests work, what don't work. Some doctors' offices that are doing them rapid tests are going to do them because that's what they're doing. But I think you've got to look at the efficacy of the test and how it can be replicated. And so to Dr. Silver's point is going, we don't make money off of the test. In fact, we pay for the test to get done with the lab, but we know that the results that are coming out of the laboratory are trusted and have efficacy to them. The worst thing in the world is you want to go out and get a test that's not reliable. The other thing that I think is really important, everybody kind of saw that one of the urgent cares in the city were reporting out that their antibody test came back and they were positive and therefore they were immune. Nobody knows that. Nobody, if just because you have antibodies, we don't know, because it's a novel virus, we've not seen it before, whether those antibodies will protect you from a re-exposure. So I think there's a lot of information, and what we do with that information right now is I don't know that we know all the answers to make definitive decisions, either legislatively or from a policy decision, about what all that means. You know, for me, the chances of me having a positive antibody test is probably zero. I am 99% working from home. I haven't been out to the grocery store. I haven't been any place where I would come in contact with somebody who's got the virus. So I come back with a negative antibody test. Well, what will that mean for me? Do I have to stay home? Because I'm high risk, do I have to stay home until there's a vaccine available? And if that's true, I'm home for 9 months to a year. Oh, good grief. I'm not sure that my husband could handle for that long period of time. I can come back to work, but I'm not sure how that works, knowing that I've not been exposed to the virus.
I think that's one of the problems, that nobody knows a lot. We don't know what we don't know about this. And every day there's something new that comes out where they say, okay, now we have to pivot about it, because now with what they're finding with the children, for so long the news was saying, oh, children aren't affected, and now it seems that they're getting this what is Dr. Silver, Kawasaki,
pediatric multi-inflammatory syndrome. It's you heard the word Kawasaki thrown around out there. Not Coxsackie. The Coxsackie is the first in the mouth, the hand, foot, mouth, but everyone kind of gets a little confused like that. But this is Kawasaki. Kawasaki is it's relatively rare. I think it's 25 per 100,000, but not that rare, because we've come across that every couple of years. We get a couple of cases, and it's not unusual to have a post-viral syndrome. We see that a lot in pediatrics, meaning I had a kid I saw in the hospital last week. He had a virus, and 2 weeks later, he develops abdominal pain that looks like appendicitis. That's mesenteric adenitis. We have these arthritises that come from 3 weeks after you have a virus. And Kawasaki is a disease of the blood vessels that comes, and they think it's from being exposed to a virus. And we've seen this for many years, and it comes with fever, rash, red eyes, but really, swollen extremities. But really, what worries people, it could give coronary aneurysm. We've become pretty good in identifying it, and there's very good medicines for that right now. What they're seeing now with the COVID is the same kind of thing. It's about a month after the peak of what we've seen with COVID, and we're seeing similar to Kawasaki, but it's affecting some of the smaller vessels. I think the other thing it's affecting, when I think about Kawasaki, we're thinking about 5 years and younger. This seems to be doing older school-age children, and even I saw teenagers that had it. So it's scary, but it's not unusual. In the pediatric world, we see post-viral infections, some of them more serious than others all the time. In the grand scheme of things, it's still very rare. So I don't think people should get get crazy about it. We're talking about 50 people out of millions of people. We didn't see it coming out of. This wasn't reported out of China, out of all those cases over there. They first started talking out of Europe, so we're just seeing it after a lot of cases. What I think the take home from this is people are still getting sick, and they need to pay attention to their kids and not fear going to the doctor, because over time we're going to miss important things. So with this inflammatory, kids are doing really well. They're treating them in the hospital. They're getting them in there when they need to go. But sitting at home on a fever for 4 or 5 days, when you should have been at least call your pediatrician for a telemedicine visit. Let them decide if you need to be seen, and don't let things go. We still have to do that. I had a less than 1 month old that I saw quickly on telemedicine. I said, I can't evaluate a 1 month old, on telemedicine that might be sick. And he came in and they had a 103 fever. We had to get him in the hospital, right? But if we're not there, if we're just saying no one come in, we're going to miss really important things. So this is another one of those things. It's still going to be relatively very rare. It's kind of scary to watch. We don't want to see any of it, but we have to respond and still watch our patients and make sure we're not missing anything. So we want people. I'm hearing the same thing. Emergency rooms in the city are not as busy as they should be, at this time of year. So, we don't want to miss appendicitis. We don't want to miss anything. So that's really kind of my take, and this is really brand new. I'm watching every day the new cases that are coming in. I'm sure we'll know more about it in like a week or two. But
So
the key, yeah.
anybody who's out listening, what would be the warning signs that you would, as a pediatrician, tell a parent that they should pick that phone up and call their pediatrician? What should they be looking for?
You know, I would say anytime, you know, fever itself never really scares me, you know, on itself. When someone's very happy and they're playful and you know, they look good, we could watch a fever for a couple of days. I would say if your fevers are going on for several days, but if you're having belly pain, if you're lethargic, if you don't look well, if now we're getting fevers and a rash and belly pain and a red eye, those are definitely things we should look for. And if you're real cranky or lethargic in any way, but we could assess that. I've done some telemedicine, and you know, I've seen kids with fevers, and I saw them doing cartwheels in the back, and you know, I knew I was a little less worried about them. It's been kind of fun for me. So I actually take the parents', you know, gut instinct into that, and if someone doesn't, this is not my kid, and the fevers are real high, I wouldn't wait the 3 or 4
Sure.
days. But you know, I think with this going on, anyone that has like 3 days of fever, you know, at that point you should call the pediatrician because there are tests we could do that could kind of screen for that. There are things called they're inflammatory markers, CRP or SED rates for anyone in the medical field. So if I have someone and they have a fever and I'm worried if this is going the wrong way, if I do one of these and they're very high, I know I got to get them evaluated more. If they're really very low, I know it's very reassuring. So there are things that can be done and looked at. I think you know we're available every day, all the time, and most doctors are. But don't be afraid to contact your doctor. Don't be afraid to be seen.
I think that's really important because people are scared. People are really, really scared. So to be able to say, come in and see, it's still safe to come into the doctor is really important because you don't want to miss those things, especially for anybody, but especially somebody's child. And I think this is a good segue to talk about, you know, from the chamber point of view, we're helping people to reopen. So we're looking at all the CDC guidelines and you know, once the governor says that in the region says that we can reopen, what are the precautions that people need to put into place? But from your perspective as healthcare providers, you know, what are the things that are important and why are they important? You know, we hear about wearing a mask, but yet, Linda, you and I speak about how we've seen throughout the county clusters of people hanging out, socializing, not wearing masks. So if you could both talk a little bit about why these things are important and what your recommendations for that would be, as far as especially the differences in the types of masks and when people should be wearing gloves and those things.
Avi, you want to
Yeah,
do the
I have to
clinical
say,
side, and I'll do the social side.
yeah, I'll start. You take it home. But I would just say, when this first started, I had to review every case of someone that came down with COVID and decide who went home for quarantine and who couldn't come to work. And in the beginning, people weren't using common sense. They may have been sick and they came to work. People weren't wearing masks. They were hanging out with other people on the weekend, and we were getting a lot more. They were getting sick. Now we have all the cases that we're seeing are with our employees are usually cases that they've gotten outside not being careful, and we've had people that have worked very closely together exposed to one of these people that have COVID-19, but everyone's wearing a mask, everyone's being careful, and it's not spreading in the health center if you're doing the right thing. It's actually kind of interesting to me. Some of my docs that are out there and my nurses, and God bless them, they're going out there and they're swabbing sick people all day long, and they've all done their antibody testing, and they said, "I can't believe I'm not positive." When you're aware of it, when you're doing the right thing, you said, "Oh, I'm at risk here, and I'm wearing I'm wearing the mask, I'm wearing my PPE, and I'm washing my hands, and I'm being careful. No one's getting sick." So even when I have people that have been in close contact, but they're wearing the mask, no, it's not transferring. So I think we have to kind of stay real vigilant about that. And I mean, I know it frustrated Linda in the beginning when people had to go home, like, what? Stay home if you're sick. You know, if you think you're sick, if you're like, oh, I think I'm getting a sore throat, stay home, and that does a tremendous amount. So saying it, don't go to the grocery store if you think you're getting sick. But we've seen it from the beginning. We had a lot of people in quarantine, and now really the cases are come down a lot right here where we're seeing COVID patients.
Yeah, from a social standpoint, we are never going to be really safe until we have a vaccine and an antiviral, just like we have for the flu. So you get your, I get my flu vaccine every year. I had the flu once. I swore I would never get it again because I was so sick. My lungs just couldn't handle it. And I said, never again. I get my vaccine. If I were to come down with the flu, which I've never done, I know that it would be not as bad, and that there are antiviral medications that I could be prescribed if I, get off my chair, get to the doctors within, 48 hours of the onset of symptoms, and I can get an antiviral. When we have that for COVID-19, we'll be safe to go out. So, wearing a mask is an inconvenience, but is it worth a life to not wear the mask? I mean, if I hadn't seen it for myself, I was driving from in Newburgh, coming home, and there were, God bless them, 45 folks on a hog on motorcycles sitting in front of Hudson View Taco and drinking some beer, no masks, like 80 of them on the street. We're talking people driving Harley Davidsons. A Harley is $45,000 on average. People my age, these are they're smart people, really, but no mask. And then I'm looking down on the river, and there's got to be 50 people hugging in the middle of the park and no masks. And I don't understand it. I don't get it. I don't understand why. If you're going to go to the grocery store, wear your mask. I don't know so much about the gloves because you're touching everything. And if you don't know how to take your gloves off appropriately, you're going to get it on your hands. So you're better off. Don't touch your face. Go home, get soap and water, wash them, sing happy birthday twice, dry them off, wash up to your elbows on both sides. Remove your mask appropriately. If you've got reusables, make sure you wear it once, throw it at the washing machine, wash it on high temperature dry, and then put them back on again. If you're wearing a disposable mask, take it off by your ears, pull it around your face so it doesn't touch anything, and dispose it in the garbage can, not on the street, not in the woods, not on a hiking trail. Put it appropriately. We got to be adults about this. We're not asking for the sun, the moon, and the stars. Just wear your PPE appropriately. Take the precautions, which are pretty simple to follow, and we can continue to curb the spread of the virus. Much more than that, what makes you safe to go back to work? If you have tested positive for the antibodies, nobody's going to tell you can't get sick again. So should that mean you shouldn't wear your face mask? Wear your face mask. If you have no antibodies like me, wear your face mask because I don't want to get sick. So, we know the simple precautions. We just need to take them and be responsible for our own actions. We cannot control the virus. What we can control is our actions, which will then stop the spread of the virus.
Exactly. So now there's a couple of questions coming through. So one of the questions is kind of based on what we're talking about preventing the spread of the virus. What are your opinions about a wave 2? What are you seeing? Do you think that's a possibility? And then with the flu, and I know that this is kind of all hypothetical, so I'm not holding you, Dr. Silber, to anything. But do you have any kind of advice for people out there to avoid it? Things to do? What we should be looking for?
For the second wave?
Yeah. Or is there going to be a second wave? What do we do to prevent a second wave?
I think from a public health point, we've gotten really good, and there was almost like a period of denial at first. That this wasn't going to happen. I think we probably talked, at our senior staff meeting, what's going to happen with that virus over there? Oh my God, it won't come over. There was a denial period, but I think we're all out of that. So we're going to be going. I think we're going to be opening up more in the summer. I think you're going to see people coming back. And I think we have to listen to our officials. And if we start seeing spikes, we have to listen to their advice on that. And then it's going to be real important to get vaccinated for the flu in the fall. So you're not confusing flu and COVID. And hopefully, I think I've already seen people more interested in vaccines now that they realize how important that could be to society. To go off topic and plug flu for a minute, the flu vaccine, this is what I was saying a few months ago, it only stops the flu 40, 50% of the time, but it does like 80, 90% of the time effectiveness of stopping you from going to the hospital and stopping you from the PICU. So, vaccines are not necessarily 100%, but they actually make disease more mild. And that's what we learned here. We don't want to overwhelm our health system. I don't think, you really kind of get rid of the virus. I think it always has to run its course and get some herd immunity. So we've done a really good job, I think, in avoiding it going too high, what we've done with the distancing here. But since if we're going to say 12, 20% of the people have it, that's not enough to have herd immunity. So I imagine it'll pick up again in the fall, and how we'll have to kind of listen to our officials to see what to do with that. I don't think it'll be the same. And the whole idea the whole time was to flatten the curve. I think being outside, I do think the virus is transmitted more readily inside in closed spaces. So we're going to continue to see it go down in the summer. I hope if people are smart. And then it'll be picked up again, and we'll have to see how quickly it'll be picked up again. But I think people will be more willing to listen, because we don't want to go through this again. And I think if we listen to the advice we're giving, if we're smart about it, we're going to see a peak. But I don't think we're not going to see a peak like we had in March or April. We're just going to see it kind of flip again.
Up and down and up and down.
But you did say, you can't hold me to anything.
No, I'm not holding you to anything. Nothing. And I know this is all hypothetical. This is all hypothetical. That was one of the questions that came in, because everybody's trying to figure out what's going on, because every day there's something new that happens. Every day they find out something new. Like last night I was watching something and they were talking about it, and I've already exhausted my medical expertise in this conversation. So what I'm about to say may or may not make any sense to you, Dr. Silber, but something about H2 receptors and histamines and the way it grabs the virus. And it was fascinating, but they said, and we're just figuring all of this out now about how it affects things. So it's like the longer things go on, the more research will be done on it. Linda, you had meant one of the things that I see from our perspective, the phone calls that I've gotten, is this virus, because there is so much unknown about it, because it is so scary, because we have incurred so much loss. There's such an uptick in depression and anxiety and domestic violence. And I know that Cornerstone has a behavioral health center. Can you and also addictions and alcoholism, we're seeing overdoses. Can you speak a little to that?
Sure. Last week we did a Cornerstone Facebook Live with our Chief of Psychiatric and Behavioral Health, Dr. Ryan Meshalem, and our child psychiatrist, Dr. Ayub, and really kind of talked about what's normal and what is behavior that you would be concerned about. So, right now, we as a species like to be in control of things. We like routines. We like things to be organized and systematic for the most part. And, we talked a lot about kids, that their routines are totally disrupted. Before COVID-19, kids they'd be home, they would have dinner with their parents, do homework, take a shower, go to bed, get up the next morning, have breakfast, get dressed, get their book bags and their lunches, get on the bus, go to school, come home, do their after school activities, and repeat the behavior every day. There was a routine. The routine doesn't exist anymore. They don't know, there's no school. They get to see their teacher on a computer for maybe an hour or two. Homework is being done differently. One parent is home, or some other arrangements are being made. And so there in itself, the nature of their lives have been disrupted. And then if they have a parent who's still working, if they've been the same bombardment that the adults have seen, if you go out, you will get sick. And if you get sick, in a child's mind, you will die. So children have got this really very difficult fear that they have about what will happen to their moms or dads if they're still out working. And then the isolation from everyone else. Like I've got 6 grandchildren. It's been really tough for all of us. When a 5-year-old granddaughter calls you and say, "Will you remember who I am?" because you haven't seen me. Yeah, exactly. So broke my heart. There's a 5-year-old being afraid that Nona's not going to remember her because we haven't seen each other. So those are real. Adults, the same thing. Think about it for a moment. If you've had a loved one who's gone through this virus, and think about if you've lost a loved one, what that means, or if you've lost your resources, you lost your job, or something else has happened to disrupt your home life. People tend to do things to alleviate pain. Alcohol is a really good one. It numbs all of the pain and makes things seem a whole lot rosier. And drugs will do the same thing. So anytime that you see a disruption in the normal behavior, we see a spike in behavioral health issues and substance use disorder issues. It happened when the markets fell, and people who were living in big, giant McMansions, I call them, giant houses on a tiny little plot of land. They were all down in the stock market. They were in New York City. They lost their jobs. They lost their homes. They lost their BMWs and all their other cars. We saw a huge spike. We're in the same place now. But I think the most important thing for people to know is I think the stigma around behavioral health and mental health issues is greatly diminished now because people understand it more. And we know that if people are untreated and we don't recognize a behavior around illicit drugs, we know that something is sure. The possibility of death is high. The possibility of an overdose is high. People need to be in treatment now. So behaviors that our two psychiatrists talked about is if there's a repetitive behavior of something that's out of the ordinary and it's on for longer than a week or two, you probably want to make a telephone call or some intervention suggesting that somebody make that phone call. If you see in your home that you've got a teenager or a young adult and your medications are missing, there's a big red warning flag. If you see an alcohol bottle that once was full and now isn't, and you didn't drink it, you probably need to do an intervention. These are really real horrible things that are happening, again, in the shadows. But the help is available. Our behavioral health is open for telemedicine. We see new patients, 563-8000. You make a phone call, we get you in. And of course, we can still do additional intakes if anybody is, if there's a problem with heroin or opioids, the same 563-8000 number will get you connected to our substance use disorder program. No one should be out there alone. And we're absolutely here and willing and able to help.
And the number, Linda, is 563-8000?
Correct.
Okay. So if anybody out there, if you're listening or you're watching, because this is going to be on Facebook, going to be living on Facebook. So the number is 563-8000, and there is no stigma. It's
non-judgmental zone. The end of the day, it doesn't make a difference. I always, my staff knows this and the community should know this. We have never walked in the shoes of one person who's in the middle of a crisis. We don't know what that feels like unless we have been there, and most of us have not. I said this in an interview, is that people are talking about we're all in the same boat. We're not. Our boats are different. My boat is relatively, okay, I have a home. I got two people. The only probability could be the husband killing the wife because I'm home and I shouldn't be. I should be at work. So if you don't see me for a couple of days, figure out where Charlie is and go find out what he did with me. But I have a backyard. I can go safely into my yard. My neighbors are not close, so social distancing is not an issue. If I live in the city of Newburgh or in the city of Middletown or even the city of Port Jervis, where there are apartment buildings, where there's no park to go to, where it's difficult to maneuver, where the income levels are very, very different, we're not in the same boat, but it's the same virus that's just affecting each of us differently. Those of us who are lucky enough to be able to socially isolate, our likelihood of getting the virus is much greater, much less than it would for somebody living, in conditions that we don't have.
So along those lines, we're very fortunate. I'm in my dining room. I have all of my salt glaze and my creamware around me. I have a backyard. I have people who love me. My kids are safe. My mom's safe. But what does this look like, say, to people who are really vulnerable, like people who are homeless? I mean, are you seeing that? How is this affecting people who don't have a home? They don't have the support network that we have. They don't have easy access to medicine. But I do, give you folks kudos because I know that this is one of the populations that you work with so well. So what does that look like for people who are homeless? How is that working with them? Is their higher experience? Do we know anything about that? Are they coming in to see you?
It's a very hard community and population to engage with, to be honest. Everybody who's homeless, a majority of homeless folks are homeless because there's an underlying disease, whether it be mental illness or substance use disorders or a combination of both. So those that we have been able to engage, and of course we're still connected to them and seeing them, homelessness is everybody's issue and should be everyone's concern. We're still open to get them, but it's tough to get them. They don't have
Right.
they don't have an address. They don't have a place where you can send an outreach worker to. But as best as we can continue to be engaged with, well, we have community workers that are doing work differently, but still engaged in our communities. We're going to be doing some antibody testing and COVID-19 testing in the city of Newburgh on the 15th and the 19th. That anybody can get a test. So we're putting up flyers. We'll be doing social media. The flyers will be important because they'll be in the bodegas. They'll be throughout the community for people to see. But
Look at that. Look at that. See, Nicole put it up there for everybody to see.
So we'll be able to do these. We ask that they get an appointment first. Call 563-8000. We'll hook you up with a telemedicine appointment and figure out which test you should be getting, whether you have any symptoms of COVID-19 or you should be tested for the antibodies should you have had the virus or suspect you had the virus, or even if you didn't have the virus and you just want to know, we'll be able to do that too, and that's open to anyone.
So I have a question. We'll be running out of time shortly. We have a couple more minutes, but just as far as with the testing, so if I'm symptomatic and I feel like I'm symptomatic and I come in for a test, or I've been exposed, so I've been exposed to somebody and I wait a couple of days, I wait, 7 days, I come in for a test and I'm negative today. What does that mean? I'm going to be negative in 2 days? Or should I come back in for a test? I mean, that's from my own perspective. I wonder about that. If I've been exposed, if I hit the wrong day to be tested, does that?
You have 14. If you had a real exposure, you're supposed to isolate for 14 days because that's the time that you might actually show up positive. They're not exactly sure when you're testing me positive. It's going to be like the day of, 1 day beforehand. So I don't necessarily test unless you want to baseline when you're asymptomatic. But in that next 14 days, you are going to stay away from everybody.
Okay.
And isolate because if you think you had a real exposure, because you don't know if you're going to be symptomatic the next day, and it's very possible that you're actually going to be much more contagious right before you get sick and start feeling. So if you're living with someone that became COVID, that ends up getting diagnosed with COVID, you are now at risk for developing that. So you should really isolate for 14 days after that. And at any time in that place, you would actually want to get tested. And your first point of contact is to actually call us and do a don't walk in, but you call us and you do a telemedicine visit. And then if we think you need a test and you might be symptomatic, you're going to we do the testing outside, and keeping everybody safe. So that's your first place.
Okay, so is that the same number, or do you have a different number from the behavioral health? Same. So that's 563-8000.
Mm-hmm.
That's the number for everything. That's
everything. One number.
That's great.
Get you in. Lynn, I just want to send kudos out to you and your staff and the chamber. I mean, I'm a very proud member of the chamber, have been for my whole career here at Cornerstone, proud to be a member of the board of directors. I think understanding what chambers do is you have stepped beyond the reaches of what a normal chamber does by engaging all segments of our community to understand the importance of business direction, answering questions from businesses about PPP, small business loans, bringing information to the community like this that we've been able to do, and touch on healthcare issues. So I couldn't be any more proud of my relationship with the chamber. I hope that all the members feel the same way that we do. Our chamber is our voice, and I'm happy to be part of all of it. So thank you for all that you've done.
Well, thank you. I mean, we we've had the conversation. I just see us as like the hub of the wheel, and we're just bringing people together. We don't do the great work that you do. And I'll tell you now, I will commit the chamber to partnering with you for a flu vaccine, for a flu.
Yes, thank you. Yes.
You're welcome.
So,
You're welcome.
Some of the stuff scroll across the screen. So just a couple of things that I wanted people to take away. Just a few things. Wear your mask anytime you're out in public, whether you've got an antibody or you don't have an antibody test, wear your mask. Gloves, I would recommend, unless you know how to put them on and take them off in a safe manner, do not use gloves. Wash your hands. Happy birthday to me twice. Washing between your fingers, soaping up to your elbows. Don't touch your face once you come home from the store. Make sure you social distance. The probability of you getting COVID-19 by walking past somebody is probably really low. The chances of you getting COVID-19 in a grocery store because you stood next to somebody for more than 10 minutes becomes much higher. So be careful with your surroundings. Make sure you know where you're standing. If you need medical care, if you have underlying illness, do not be afraid to see your doctor. I don't care who your doctor is. I'll give a public service announcement to all my colleagues in every one of the practices in Orange County. Do not be afraid to go see your provider. Make sure that your diabetes is in control. Make sure that your hypertension is in control. Make sure that anything that you have an underlying illness is managed correctly. If you are a parent, please do not be afraid to see your pediatrician. Our children are our treasure and the future. Make sure that you equip them with everything that they need to be healthy. Do not be afraid. If you see your child is febrile, has a fever for a couple of days and has got a rash and is not themselves, pick the phone up and call your pediatrician. Help is here. We are here. Call us. Our environment is safe. You do not need to be afraid to come in. We're masked. You will be masked. You're not allowed in our health center unless you've got a mask. And if you don't have one, we will give you one, not to worry. Every precaution will be taken. Fear is the thing that makes the virus continue to go. Inability to understand it and to cope with it and to manage it and to manage our own health is what will continue to have this virus spread. We are in control of our actions, all of them. Social distancing, PPE, managing our own chronic illnesses, and ensuring that our children are safe. That's what we can do, and we can do that every day.
Well, thank you for that, Dr. Silver. Do you have any that you would like to end with?
No, I think Linda really kind of hit that. This is a marathon. We're going to be dealing with this. This is the new normal, and we need to make sure we don't neglect everything else in our lives. And our routine healthcare is really very important. So we're here for you. Come on in.
I do want
to be set off once in a while because enough is enough. We don't need to know any more about the numbers. Go outside when the sun is shining and get a nice breath of fresh air.
I do, absolutely, and it is getting warmer. But I do want to just let you both know that there are many comments as I'm watching the scroll come down, thanking both of you and thanking you for your team about how people appreciate you, and some of the people are your patients, and they say thank you. So you guys are heroes to us. You really are, and I thank you for being platinum partners with the Orange County Chamber of Commerce, for being a strong supporter of the chamber and the business community. You always have been. And, Cornerstone has always been there. You folks have always been there for us as the chamber. Linda, you've always been there for me in my darkest time, my darkest day. You came through the lawn with your high heels, not caring. And I know that dedication and that love is the way that you manage Cornerstone. And Dr. Silver, I've seen you at work too, and you have the same passion and dedication for your patients. And that is what will get us through, is the compassion and the love that we have for each other as human beings. So I want to thank you so much for being here with us today. And the number is 563-8000 for behavioral health, for telehealth, for bringing your child in who's sick, for coming in, and you will get a mask at Cornerstone Family Healthcare. And you are in Middletown, Newburgh, Port Jervis,
Highland
Pine Bush,
Falls.
Plattekill,
Platte, Binghamton.
Binghamton, Plattekill,
Did I
Highland
get
Falls.
Highland Falls. Yeah, we're
Island Falls? You're
New
basically
Windsor.
throughout Orange County,
Okay.
Orange County. And Ed says you are all our heroes. Thank you.
Well, I
So
just want you to know that we are proud to be of service. For everybody that's watching, we're sending you our own viral love and hugs.
don't say viral. Don't say viral.
Well, it's virtual. We want you to be safe. We want you to be well. We're here for you when you are well, and we're here when you're not well. And it is our pleasure and our honor to be of service to our community.
Thank you, and thank you to
Thank
Nicole
you.
Clark, who is doing all of the background. So Nicole, she's on our team. She's our director of communications. So yay! Thank you, Nicole. You did a great job. And everybody else, have a great day. Be safe.
Thanks.
No
Okay,
gloves. Wear your
bye-bye.
mask. Okay,
Exactly.
thank you.
Thank you. Take care. Thanks, Avi.
Bye bye.